Assalamu alaikum viewers. This is Sajeda Khan, the program coordinator from the Islamic Foundation of Toronto. We are here today to introduce the CAN vaccine project funded by the Public Health Agency of Canada. Islamic Foundation, in partnership with Scarborough Health Network and Social Services Network, is working towards supporting Canadian vaccine confidence and uptake, as well as addressing barriers to accessing vaccination. This exercise requires diverse strategies and targeted interventions. There is no one-size-fits-all solution, and a multifaceted approach is crucial for reaching all Canadians, and particularly Canadians who historically have been underserved and whose health negatively impacted by a range of social determinants of health. The Immunization Partnership Project is intended to improve vaccine coverage by supporting the various ethnic communities living in Scarborough, Toronto, and the GTA areas. As part of our outreach strategy, we have been able to reach out to our community at large by creating outreach campaigns, through flyers, through social medias, announcements during our Friday congregation, and through our community partners and their networks. So far, we have organized 5 COVID vaccine clinics at the Islamic Foundation of Toronto and vaccinated about 2,400 Canadians and still continue to do so. We started the project last year in July, and the project is still continuing to make sure we vaccinate maximum amount of people living in the communities. Information brochures with adequate information about COVID-19 have been printed, and community fairs are being organized in parks and community centers to make sure the information reaches to a layman. Last year, we were all serious about the vaccines, considering the fact that each and everyone might or suffer from the COVID-19 situation. Now, 1 year later, we still have to put our guard up. And to make sure that everyone is safe in the community, we are creating awareness campaigns, information campaigns, and interviews through social medias such as this one today. Apart from the above strategies, today we will be interviewing our guest, Naseema Daar, to learn about COVID-19, a bit about the history and origin of COVID-19, and the current situation based on best practices in Canada. We underwent a lockdown. We tried to keep ourselves safe. What now, once the situation is reopening, once we're getting back to normal? Is the situation really normalizing, or there's something more to that, and how we can take care of ourselves and the families and the communities by making sure that we are not still spreading the COVID-19? In studio today with Naseema Daar. So we're welcoming Naseema Daar to an interview, and a bio of Naseema Daar. Naseema is highly motivated, organized, multidisciplinary worker in health sciences. She excels in planning, management, and organizing health promotion programs, the facilitation of community-based health programs with people from diverse communities. Naseema has expertise in health sciences and public health with an extensive experience in clinical and teaching community medicine, public health, to student nurses, community health workers, CHWs, and personal support workers. She has been associated with community health programs and in health promotion with community work groups to advocate healthy, strong communities in Toronto. Today, we welcome Naseema Daar, and we will interview her with few important questions related to COVID-19. We will repeat a little bit of her history and then try to get some information through Naseema about the current situation and how we can help ourselves. We welcome Naseema Daar to the Islamic Foundation of Toronto's CAN Vaccine Project interview today. So Naseema Daar, please join us on this question session today.
Thank you.
Naseema.
Walaikum salam. It's really great to be here, to be talking to you regarding this CAN vaccine project of IFT.
Yeah.
That's a fantastic job it is doing just to boost this COVID-19 problem that we are facing so badly. So it's really going to be good to be, just giving an account regarding COVID-19 to the
Yes.
viewers.
Yes. Thank you, Naseema. Thank you for joining us today. And my first question to you will be, Naseema, COVID-19 is here to stay because we have seen the situations in the past 2 years and it is still here. Still, we get to know from the community that someone or the other is being affected by COVID-19. Can you please share some light about this subject with our viewers, as COVID-19 is here for more than 2 years now? So what can you tell us about this disease which has taken our living and livelihood in a very disastrous way?
Yes, this is indeed an important query we all need to know and remember. As we all know, the most unexpected global infection of coronavirus gripped the world so silently. COVID-19, not known previously, emerged. In the end of December 29, actually, China informed the World Health Organization of a coronavirus-related pneumonia, happening in a man working in a seafood market in Wuhan, China. The disease escalated in such a large scale globally, and on end of January 2020, the World Health Organization declared the disease as a public health emergency of international concern. That's a big thing, And on February 11, 2020, the WHO named the disease as COVID-19. And because when it started, we all said corona, 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 and we got the name COVID-19. So because it was informed in the end of December 2019. Eventually, on March 11, 2020, WHO declared COVID-19 as a pandemic. Pandemic, that means a disease which is affecting the whole world. You know what? This pandemic of COVID-19 reminded us of the Spanish flu during 1918, during the First World War. At that time, 50 million people died and many suffered so drastically. In Canada,
trying to compare that with the Spanish flu, I remember that. Yes.
It was horrific. In Canada, a total lockdown was imposed on March 11, 2020. And the Canadian Public Health Agency has activated the Emergency Operations Center to prepare the emergency operations and the consequences of the disease and to remain alert. Nevertheless, WHO has declared and said that pandemic is not over. And globally has right now, COVID-19 has globally affected 534 million people, with a worldwide death of 6.32 million.
Oh, man.
In Canada, the total number of deaths of cases is 3.9 million, and the deaths around is 41,000 right now. This is a little outline just to begin with regarding this COVID-19 pandemic we are going through.
Yeah. Thank you, Naseema. That was very well explained to our viewers. Our next question to you is, the impact of COVID-19 related problems has been so overwhelming. And we are so tired of the situation, but it's the best thing that we can do is fight back with the current situation. Can you tell us the efforts for intervention Canada has asserted to overcome the situation?
As we all know, the COVID-19 pandemic ripped through the world. Canadian political leaders and health agency leaders, played a huge role to calm the fear and panic of the people. No doubt, it was a challenging situation for all of us. The vaccine for COVID-19 was not there. The vaccine for COVID-19 was not there for prevention and spreading of the disease and protection from the disease. So during this challenging period, Canada has achieved a global recognition, all over the world for helping towards management and research and to have the vaccine made available to the world, to all of us, right? So, and by December 2020, 14 December, mid-December 2020, the first vaccine was made available to Canada. The first vaccine was given on 14 December, actually. And efforts are being made to focus on the containment of the disease, just not to spread,
Yeah.
containment of the disease and prevention and prevent the spread of the disease. That is very important. Prior to the access to COVID-19 vaccines, health prevention measures was imposed, such as mandatory wearing of masks, social distancing, frequent hand washing with soap and water, usage of sanitizers, and many, many more things, which has now become a routine for us, actually.
That's true.
So this is what is going on, that the vaccine is going on, and like IFT is doing the scan project of vaccine, it's a wonderful work that you are going through.
Thank you, Naseema. Thank you. Next question would be, COVID-19 pandemic is here to stay and still spreading within the families and communities. Can you update the viewers with the strategy that Canada has imposed to deal with the current situation? Where are we at now? We have seen a long journey. We have seen those dark days and those dark nights. We have seen that we have lost so many loved ones during that time. But what is the current situation in Canada now?
Yes, that's a good question too. The Public Health Agency of Canada is collaborating and working with provinces, territories, the international agencies, and the World Health Organization to actively monitor and address the situation. And towards the procurement of the COVID vaccines, like I just earlier said, that how we worked for it, and together with the World for the Human Rights and all that, and we got this COVID-19 vaccines available now within 8 to 9 months. The same year we got the vaccine. Like I said, Canada has now access to COVID-19 vaccine. And since then, Canada has made access to COVID-19 vaccines to everyone. And the pandemic code of COVID-19 is not over yet. It means it remains challenging, an effort to continue with the vaccination process to achieve a high percentage. This is very important, to have a high percentage of people having vaccinated is indeed very, very important. This is in order to contain the disease and prevent the spread of the disease.
Naseema, can you tell us about the approved COVID-19 vaccines available in Canada?
So, like I said earlier, efforts was made so much globally that the vaccine was evolved. They made the vaccine within the same year. And by December, we got it. Within 8 to 9 months, we got it. There's many vaccines right now, but I'm just going to mention about the ones approved in Canada. The approved COVID-19 vaccines available in Canada are the Pfizer vaccine, the Moderna vaccine, Novavax vaccine, AstraZeneca vaccine, Johnson & Johnson vaccine, and Medicago vaccine, Covifense. This is the Canadian-made vaccine, and it is approved by Canada, and it is is being given also, but the clinical trial above the age of 64 was not done. So that is why it's not being given to older people, more than 64 years old. As of May 30, 2022, the total percentage of people vaccinated with COVID-19 vaccine are 84.92% for one dose. That is just one dose. And for two doses, that is fully vaccination, 2 doses is 81.72%. Fully vaccinated with one booster is 48.60%, right? So this is the number of vaccines, percentage of people receive the vaccination. But as you can see, the first dose and the fully vaccinated doses are going fine. But regarding fully vaccinated with at least one booster is very, very low. That is, it's just 48.60%, less than 50%. And we need to have, like I'm going to further tell you how it is so important to have a higher percentage of vaccination done in the community to contain the disease and to stop the spread of the disease and and have prevention from the disease.
Yeah, thank you, Naseema. That was also very well explained because at the first, everyone was hesitant to take the vaccine because there was so much of information that would be damaged, information caused in the community for not letting the people to be prepared for the vaccine. We all heard about the news. We all heard that maximum people were quite hesitant about it. But gradually, as these days went by, as the vaccines came through, and as the education, the awareness, and the information that was being provided by Canadian health systems, the doctors, people started probably preparing their minds to take these vaccines, and that is the reason these vaccines have helped us stay alive and start working again towards the best of the health for all of us. Yeah,
absolutely.
That's true. My last question to you is, Naseema, can you tell us how the COVID vaccines help us in preventing the disease? Because sometimes when people are taking one vaccine, they're hesitant to take the second. They say, okay, we have taken the first one, so we don't need to take the second one. Once they take the second one, then they say, is a booster shot necessary? And eventually they end up taking the first booster shot. And after the first booster shot, again, there's another question saying, is the second booster shot necessary? So can you please help our viewers understand how these vaccines help us and the immune system in our bodies?
Important question, because it is very important to have this booster doses. So I'm just going to explain a little how it works. Now we are in the third year of the pandemic, right? And COVID-19 is a life-threatening disease. Like we have seen, the things that have gone on was horrific. And the risk should not be taken getting the disease and getting critically sick, requiring hospitalization and even death. The safest way to have immunity against COVID-19, is to get the vaccine shots to reduce the chances of getting seriously ill and dying. I may mention how it works. I may mention that after getting the COVID-19 vaccine, you can still get the COVID-19 disease, right? But the symptoms are too mild and sometimes even go unnoticed. I'll give you an example of myself. We were all good. I had 2 vaccinations done, and my booster was due. The week my booster was due, there was a person in the family traveled and came home and got positive. So we went for our test, and the three of the members in the family, all of us, we got positive. The test came positive. The COVID test came positive. And since we have had already 2 doses of vaccines earlier, fully vaccinated without the box, the booster was expected, and I was to take that week. I couldn't take it because of the positive thing that came out. So what happened was, but nothing happened to me. If I hadn't done the COVID test, I wouldn't know I had COVID positive, right? I had no symptoms at all, excepting for a little scratch. That's it, in the throat. That's it. So, like I said, you may get symptoms. It's going to be mild and sometimes even go unnoticed. So this is an important factor you have to keep in mind, right? Don't take it like you can say, oh, since I've had vaccine, you have to take all the precautions, no doubt about it, right? But you can still you're not going to die or get critically sick with that. when the vaccine, how does it work? I'm going to tell you about this. When the vaccine is injected in the body, it builds immunity by making a defense mechanism, that is, building a security system in your body to defend and protect the body when the virus attacks you. And then this is how it prevents you from getting the COVID-19 disease. So you can see how important it is that we all get fully vaccinated along with the boosters. I repeat, along with the boosters. That reinforces your immunity, right? It is very important to have a high percentage of vaccinated people around to protect us all from the spread of the disease. Right now, we are around 50% in Canada. So we at least need around 90% to attain that kind of containment of the disease and prevent it and from the spreading of the disease. So this is, I think, I'm not going to bore you all with many details. This is, I think, what is discovered, this a little summary regarding the COVID-19 and the vaccination process that we are having and how the CAN project of IFT is managing so well. And I'm really so passionate about this, how they're doing it, and then how they are going to proceed, encouraging the people to have the boosters as well. Thank you.
Thank you, Naseema. Thank you for joining us on this interview, and thank you for explaining it to our viewers in a very beautiful way. I hope this message reaches to all the communities around here, and we hope we still continue to keep ourselves on guard and to make sure that we protect our families and we protect the community. So thank you so much, Naseema, for joining us. So
thank you for having me for this program. It was very nice and I really loved it. Yeah. It was very useful and reaching out to the people.
Yes. Thank you. And once again, to all the community members, thank you so much for joining us on this session. Thank you for being educated and thank you for taking turns in going up to the vaccine clinics. Just to give you additional information, Islamic Foundation of Toronto has partnered with GoVax team. There's a beautiful Go bus that has been donated and created as a mobile clinic, and that Go bus is going to be at the Islamic Foundation of Toronto on June 12th from 10 a.m. to 6 p.m. So if you are listening to this message, please pass on this message to your family members. And these sessions are on a walk-in basis. You do not need to take an appointment. So please walk in through the gates of the Islamic Foundation of Toronto at 441 Nugget Avenue to get your vaccinations. Your first vaccine, second vaccine, your first booster dose, and the second booster dose for people above age 64. So once again, we thank all the partners, Scarborough Health Network, Social Services Network, and GoVax team, and EAWAZ for reaching out to us and for broadcasting this episode so that it reaches out to the maximum community at large. So stay tuned for more information on the CAN vaccine project, and please share this information with each and everyone out there. Stay safe, please stay masked among crowds and keep yourself and your family safe. Once again, your host, Sajeda Khan. Thank you so much for watching this episode.